I am Tara Smith. I'm a professor of epidemiology.
I'm Dr. Christopher Wolverton, professor of epidemiology
in the Kent State University College of Public Health.
Hold up.
How do face coverings help prevent spread?
So face coverings basically keep all of your droplets that you are expelling when you talk or breathe or cough or sneeze inside the mask. And so you're not transferring them to other individuals. You're not putting them out in the atmosphere for others to pick up.
When is someone with COVID-19 contagious?
The incubation period for COVID-19 disease is typically 5 or 6 days, even though it can be up to 14 days. As a result, the person is contagious when they start having symptoms. But we've recently found that the person is also able to be contagious up to 48 hours before they themselves are having symptoms.
So in that 2 to 3 days before you show symptoms, you could be out spreading the virus to others. So if we wear some kind of face covering the entire time that you're out in public, you would reduce that potential spread to others because, again, you keep that virus within the face covering and don't spread it to others.
What about people with medical conditions who can't wear a mask?
A number of people can't wear the traditional face covering because of the way it constricts around the nose and the mouth and the chin. For them, accommodations can be made using other types of materials, especially those that don't cover the nose and the mouth directly. One example is like this face shield. This type of face shield is different from the traditional face shield in that the sides are a little bit longer, come back towards the back of the ear, and it has a built-in chin shelf. This would also trap the mucus particles that have the virus in them. They would hit the shield and eventually, as they dried out, would settle into this chin.
If the virus is small enough to pass through a cloth mask, how are they helpful?
Viral particles are indeed very small, especially the COVID-19 viral particles. They're about 100 nanometers, which makes them small enough to pass through many different types of fabric. However, the virus particle itself, when it infects a cell, gets into the cell, makes more of itself, and leaves the cell. But that cell is typically underneath a layer of mucus in the upper respiratory tract. As you sneeze, cough, even speak, the mucus particles containing those very small virus particles are one unit, and it leaves and travels together. A facial covering, like a cotton mask, will in fact trap those mucus particles and prevents the viral particles from leaving beyond the mask.
Is it true that a mask lowers oxygen levels?
No, it is not true. Oxygen can get through the mask just fine, as well as any carbon dioxide that is breathed out.
Doesn't wearing a mask encourage people to touch their face more?
I haven't seen any good evidence that it does. But either way, whenever you're wearing the mask, if you're touching the mask, if you're touching your face, if you're touching other surfaces, again, you want to continue with your hand hygienes.
I know when I wear a mask, and it might be because of my training, but I touch my face less often because I really don't want the mask, one, to be dislodged, and two, to contaminate my hands.
So regardless of if you're wearing a mask or not, you still want to be washing your hands frequently or using hand sanitizer if you're in a place where you don't have access to a sink and soap and water.
When the outbreak first happened, we were told that only sick people should wear masks. Why should everyone have to now?
Right, so in the beginning, we didn't understand that there was a significant level of pre-symptomatic transmission. So again, spreading the virus before you show those symptoms.
If I don't know that I have the disease, but I can contaminate a surface or I can cause you to get infected, I would want to wear a mask to prevent that from happening.
So it's actually wearing masks is for the same reason that we suggested sick people wear it from the beginning, which is to keep that virus that you are expelling inside the mask.
And that was the primary reason that we went from asking only sick people to wear masks to then asking everyone to wear a mask because of the asymptomatic carrier.
Does wearing a mask mean you'll infect yourself with your own bacteria?
No, your own bacteria is your bacteria, so they're already yours. If you share them on the inside of the mask and you touch them, because they're already yours, you're not going to cause an infection. But we still want you to wash your hands and get them off your hands.
If none of my friends, coworkers, or classmates are sick, why should we wear masks when we're around each other?
If our colleagues are sitting right next to us, they're not sick, they say they're not sick, I know I'm not sick, I still want all of us to wear a mask because of that asymptomatic carriage that we may not even know about, but can certainly cause any one of us to get sick.